Hey everybody out there in internet land, it's Celisa Ellis, also known as the Fixer.
Hi, I'm Libby, also known as the Nugget Digger.
And I'm Natalie, the Y-Finder.
So today we're going to talk about migraines. Migraines is a terrible headache. So what is a migraine? A migraine is very different than a regular headache. I get headaches, not very often, but I'll get sinus headaches, or I'll get headaches in my eye, or just headaches. What makes a migraine is your light sensitivity and your sound sensitivity, along with the pain in your head. Usually a migraine will come up from your neck around your ear. We kind of call it a question mark headache, which goes along with the light sensitivity and the sound sensitivity. So when somebody has a migraine, they're really debilitated. They're typically not able to function in the world. I mean, I can't even imagine driving with that kind of light and sound thing going on.
No.
So people are basically staying in a dark, cold room with a pillow over their head so that they don't
hear things,
see light. They're just, I can't imagine going through such a headache. I've had bad headaches before, but that just sounds
awful.
Sounds terrible.
There's
also something called a visual migraine. Visual migraines are not painful at first, unless your visual migraine is your precursor to your regular migraine. I know a lot of people who will get that visual migraine and they know that they're about to get a full-blown migraine. I've had visual migraines before, but I've not had a migraine headache to follow it. So what a visual migraine is basically a distorted visual path. So for me, when I first noticed when I had one, it's almost like I looked into a really bright light. So I had kind of like a distorted view of anything. So I was looking at a computer and I was trying to move my head so I could read the words around this thing that was in my visual path. And a nurse happened to be there, and I told her what was going on, and she goes, "Oh, you're having a visual migraine." And I was like, "Oh." Kind of scared me because I thought I was going to get a migraine after it, but fortunately I didn't get anything like that. So that's a visual migraine, and like I said, that is sometimes the precursor to a full-blown migraine, which, like I said, is very debilitating.
It's not fun.
If you are suffering from migraines, in my studies for myofascial trigger point therapy, one of my teachers really wanted to drill down to us that all headaches are caused by muscular tension. I believe that to a certain extent.
To an extent, yes.
Because there are aneurysms, there are brain tumors and things like that that can cause you headaches as well. But for your normal everyday headache / migraine, it's muscular.
For sure.
There are a lot of drugs that you can take for migraine medicine, or migraine medications that you can take to get rid of your migraines. But those are medications.
They're medications, they're side effects. There's
well, they're kind of putting a band-aid on something that will continue to come back. So
it's not going
I've had
the cause.
I've had several clients that will have 2 to 3 migraines a week. And I mean, that I can't even imagine having to do all those migraine medications, time after time. So there's lots of other solutions, but like I said, I think it's a good idea for you to go to the doctor and get
a diagnosis,
get some information, and make sure that what you are experiencing is headaches or migraines or whatever they might determine.
And there's not something bigger going on.
Exactly.
There could be multiple different reasons to be getting headaches.
You don't want to mess with headaches.
No.
Most people who have those constant migraines that are chronic, they already know that they have these migraines, and probably have already been diagnosed. So, like I said, most migraines are muscular, which are very, or it varies in why they come up, right?
Yes.
So you might have stress. Stress is
a huge
Huge
piece.
trigger.
because what happens when you stress? Yeah,
You bring
your
everything.
shoulders go up, and there's kind of a picture. I don't know if you guys can see that very well, but it kind of shows what different kinds of headaches are. That first picture, I don't know if you can see it right here. That's basically your migraine. It's your question mark headache, which is what we definitely classify as migraines. When somebody comes in and they say their headache is this way, and they have the sensitivity and things like that, then I'm pretty much going for what I know to relieve it. I can tell you that I have not met a headache in, let's see, 27 years that I couldn't get rid of. I've had a couple that it took a couple of sessions, but for the most part, they're not very hard to get rid of because it's muscle tension.
Yeah.
And that's our expertise.
Yeah. Remember I came in that one day and I came in and I was like, I can't even see out of my eye. It hurts so bad.
Yeah.
And within 5 minutes, I was like, I'm so glad I wasted all day yesterday when I could have just come here or poked at my neck myself.
Yeah. Well, it
within 5 minutes
matters to know where, and that's your, that was your headache right there. So we have information on where the headaches are coming from. We have some whys. Of course, there's stress, we've talked about, which is along your line
wheelhouse.
It is. Yep. As we know, and we talked about, before, all of our stress and anxiety goes to certain parts of our body and it's stored there. So yes, when people are going through a stressful event, it can easily trigger a migraine.
Easily.
Yeah. I have a client actually that he suffers from migraines. Most of his migraines are emotional. So he'll go through some therapy. He's in some deep dive therapy right now with his childhood. And basically when he comes out of a very tough session, the next day he usually has a pretty severe migraine. We do have a rescue frequency for him with FSM that actually within about, I think it's 10 minutes, his migraine will go away.
It's incredible.
Oh, wow.
Yeah, it's his rescue
cool.
protocol, right? So there's that, and then there's the muscular component. He'll come in and, from stress, what happens? Your shoulders just kind of come
Everything
up.
creeps up.
One of the things that we look at is the traps for migraines. So you can hopefully see these pictures. Your migraine trigger is right there. So right there. So basically it's a 3-part process for migraines in our myofascial world. Your first trigger point is going to be in your back by your scapula area. Your second one is going to be right there, and then that triggers that one, and that's what triggers the migraine. So when you come in, we're not just gonna press on that one spot. We have to look at the totality of
the muscle,
the trap, and where the function is, where dysfunction is, really what you want to say. But if you do have a migraine, I would press that spot on your neck, which is on your traps right here. I don't know if y'all can see that very well, but that would be the first place that I would start treating when I had a migraine. Fortunately, I don't get migraines. So what causes migraines? So we said stress, but also food. I had a client who was getting migraines, and she would come in and she would get relief, but she couldn't figure out why she was getting so many migraines. Well, she did this food elimination diet, and she's a very healthy eater, and she found that bananas was one of her triggers. There's a few others, but bananas for some reason stuck out to me, like,
so interesting.
wow, banana?
Right.
So even though you might be eating healthy and thinking, well, you know, these are good foods that wouldn't cause me migraines, you don't know. I mean, every body is so different.
So different.
Absolutely.
You have to figure out what's causing your migraines.
Yes.
Again, that's why I don't really like the whole drug participation in this, because I mean, if it's food, it's going to get rid of the migraine, but you're going to continue to eat those foods and not know
that that's what's causing
so
the
then
issue.
you keep sticking yourself or taking the migraine pill, however you're doing your migraine management, right? I
Like
would
you were
rather
saying,
go ahead.
I was just going to say, like a food journal would be a good idea to do that, and just start tracking, certain things, and see if that would help.
There's actually a book called The Food Elimination Diet, and what it does is it takes you off everything that you're eating, and there's a particular foods that are, I guess, non-migraine causing foods that you stay on for a particular amount of time, and then you start introducing things into your back into your diet, and that's how you figure out, that's what
it was.
So
makes sense.
it's a really interesting book. I think it's called The Food Elimination Diet. I think that's the name of the book, but that would be my first go-to if I was trying to figure out, especially if like I don't have a stressful life or something like that, and somehow
or you've tried everything, all these other things. You've reduced your stress, you've figured out sleeping, you've done all of these other things that could be causing it.
Lack of sleep can cause migraines. Hormonal changes. Oh my goodness. I think my grandbaby is going through that right now, and she's getting some. She gets migraines. There's these really interesting helmets that people have that they're basically ice packs.
Oh goodness.
And they look like a helmet, and you put it on. Yeah, I actually did that when I had my tick bite, because my head hurt so bad, and that really actually felt really good.
I bet it did.
Yeah, I bet it did.
It's a good thing, right? Because if you're trying to not hurt so much, I mean, anything out there will possibly help manage those things. So.
Yeah, exactly.
Also, strong odors that can trigger migraines, or super strobe lights. I heard that can
sensory.
That can cause migraines or even seizures. So be careful with those kind of things. If you don't know your sensitivity, be careful. Especially if you get migraines already. I mean, you might want to keep that kind of to yourself. So we can help with migraines with our hands and our elbows. And
I can help talk you through all of your anxiety and your stress, and hopefully help alleviate them that way.
So stress reduction is a really good thing. One of the things that I also tell clients that I've been working on is, when you start to feel a migraine coming on, get a hot pack or something warm to go around your neck and shoulders, so that it starts to release some of that tension. So a lot of times that helps, and it even can stave the migraine off. So heat is a really good thing. Drink lots of water. That's also a really good thing. And if you get a migraine and it's staying around for a few days, give us a call. I mean, we want to help. We want to help you out of the total pain pattern of your migraines. Migraines, like if you're getting migraines 2 or 3 times a week, please come see us. That's what we do. We want to get rid of your pain, so you don't think about getting migraines so often. I have a client that used to get migraines 2 to 3 times a week, and now I think she's down to maybe once every 2 or 3 months. So it really helps to figure out what's going on, so that you can get rid of your headaches. What else you got?
We talked about stress management. We talked about lifestyle.
Lifestyle changes. I mean, that would be a good thing to start looking at as well. you know,
Just
whether it be
tracking,
diet,
yeah, just tracking,
journal.
tracking, like doing a headache journal where you're looking at all the different things that could be going on.
Mhm.
Like, what's your stress level? Like, if you're tracking them and you see, oh, if I've had a stressful event and then I get a migraine, or I ate this, or it's, you know, it could be anything.
Yeah.
You know,
Yeah, that's why they're so hard to kind of figure out. But
because it can be so many different things.
yeah, it really can.
Yeah.
Yoga is a good way to help as well. Just anything to kind of calm you and get you kind of back in a Zen state,
Yes.
right? So
Yes.
that you're not like waiting for the next shoe to drop.
Yes.
What's gonna happen?
Fight or flight.
Yeah.
Yes.
Yeah.
Gets you out of
don't
that.
like that.
Yeah.
Yeah, so if you're getting migraines, consult your doctor. If you've already consulted your doctor and you're on a pain regimen with pills or whatever, you know, we talked about that earlier where doctors will think that you're medication seeking, but when you're in that much pain, I mean, I get that. Right?
Yeah,
I get that they're
absolutely.
looking for a solution.
Mm-hmm.
So if you are out there and you get migraines and you really want to manage it with something other than drugs, I mean, yeah, we're a good source for you.
Yes, absolutely.
What else we got? What else you got?
Well, like you said, you had mentioned the medications, and one thing that is really good for when you have a migraine is your support system. It's, you know, especially if you're in the bed and you can't get out of your room because you need complete silence and light. If you have the availability and the option, it might be a good idea to, you know, especially if you have little ones, that, you know, you're not going to feel like chasing after a little one. So if you have someone, you know, that can help, it's definitely beneficial.
No, that makes sense.
Absolutely.
Yeah.
Absolutely.
And also, like you said, I mean, if you're walking around waiting for, you know, something to happen, again, pay attention to your stressors, pay attention to what's going on in your life. And again, and it might not even be, you know, something huge. I know you had mentioned the visual migraines. The worst one I got, I was driving down the road and it started out like this, and then my vision just slowly kept closing in. And oddly enough, it only usually happens in my left eye. It's odd. But yeah, I mean, very, very scary. It was very pretty in a way, but very scary.
But you were driving. Yeah.
Exactly.
Ooh,
and I
look
was
at that pretty design.
right, exactly. So like I said, very scary, but but yeah, and I kind of, you know, looking back on it now, I was, you know, it was like a happy stress even, but I was on my way out of town. I was on a road trip, and I love road trips until I don't. And so I, you know, again, I think that pressure and that stress, again, even though it was positive, it was a good stress, it's still stress on your body, because it's not something that you're used to thinking about over and over and over again.
Right.
Absolutely.
Yeah. All right. Good talk.
Yeah.
You got anything else to add?
I don't have anything else.
All right.
I like it.
So, like we said, migraines are not fun, and we have help for it.
We can
Right.
help you.
We can help you physically. We can help you mentally. And and we want to. We want to help you feel better.
Absolutely.
So, like we say here at Pro Massage, don't just get a massage, get a pro massage. Till next time, folks. See you later.